There were 819,000 fewer workers on UK company payrolls in November than at the start of the pandemic. Hospitality was the worst hit sector, accounting for a third of job losses, followed by retail, according to the Office for National Statistics. The unemployment rate rose to 4.9% in the 3 months to October, with the jobless total now up to 1.7 million people. What can be done about it? Let's speak now to Mims Davies, who is the government's employment minister. Welcome to the show, Mims.
Good afternoon. Hi.
Thanks very much for your time. It's depressing reading, but somehow not surprising.
Yeah, it's been a really, really difficult year with the pandemic impacting and we have to remember in January, February was an incredibly buoyant employment market. We had a jobs miracle and unemployment was at the lowest in 45 years. We've had a really, really difficult year. Obviously, the news today on redundancies, really challenging. Good news that we haven't quite hit that 5% unemployment mark, but certainly really difficult for people in particular sectors where COVID's had that biggest impact. But we've got a £280 billion pound package to support people. Our plan for jobs, including furlough, is really working. And here at DWP, we're doing everything we can to support people in the most challenged sectors. I would say there was some light in the figures, though. Growing numbers of vacancies, more hours worked. So there are some opportunities, but I can't deny it's a difficult day in the labour market.
Indeed. Is rising unemployment a price worth paying to control the virus?
I think it's absolutely a question of balance, and it's extremely difficult. We know that obviously London this evening going into tier 3, the impact on the hospitality, the event sector has been really challenging. But every government has to take that balance around public health and supporting our NHS and our hospitals and our communities. I think what we've done in the last lockdown and through these tiers is kept our schools open, allow people to continue to trade and work as much as they can with a focus at home if possible, or working differently if they can as well. So we're really trying to find that way through. The vaccine rolling out and on the horizon is a really important bright spot as well. And I want to absolutely applaud businesses, employers, employees who've really been pragmatic this year, worked differently, set up their businesses differently, supported their employees as much as possible as we try to get through this, and it is absolutely a team effort.
Now, I know that this government is reluctant to inflict lockdowns and tiered measures on the population, and credit to the government for not being bounced into a circuit breaker lockdown, as suggested by the leader of the opposition, Keir Starmer, a couple of months ago. However, do you regret measures like the 10 p.m. curfew on hospitality, which has no data to back it up as being effective in control of the virus, but which, as you well know, has been very damaging to hospitality?
I think we've always tried to take the right measures, to be pragmatic, to focus on public health, to look after local communities. And I know our hospitality trade has been, really, really challenged through this. And we love our pubs. We love our community spirit that comes from them. And this is really difficult. And as you say, every single government across the globe is struggling with the balance here between public health and our economies. We're not always going to get things right. We're going to always listen to experts, be pragmatic, listen to industry. As I say, keeping our schools open has been really key in terms of supporting our children's education,
Sure.
But trying to keep as much open as possible. So, hindsight is 2020, and it's really valuable. But I think what we are doing as a government is learning as we go along, trying to do the best that we can to support jobs and livelihoods, but knowing that this does have impact and trying to put as much support out there as possible.
What are your thoughts about growing noises within the medical establishment about the possible cost to human life and ultimately, therefore, the economy of a relaxation of COVID rules in the 5 days over Christmas?
Well, I do want to absolutely remind people that the NHS is open for business, and that many of our doctors, our local nurses, our pharmacists are really keen that people do come forward if they're concerned about anything, and that they don't feel that because there is that COVID impact that they don't come forward. And this is about that balance around COVID, and also trying to keep those ongoing needs of the NHS balanced. So yeah, it's about striking that balance there. We know many people have been very isolated. They've kept themselves as safe as possible and stayed out of the community, listened to the government messages around hands and space and face, and been shopping online. I know my neighbours have done everything they can where they're very vulnerable to keep themselves safe. And we are trying to strike that balance at Christmas of people who want to get together, need to get together, but many people are also choosing where there is vulnerabilities to protect themselves and their family, and focus not on Christmas but more on spring. And I think
Which I think is, I'm sure that's what people are actually doing. I'm not sure everyone, MIMS, will take those available freedoms, because they are concerned it might affect other family members. And I know lots of individuals who will be staying at home for that very reason. They don't need the government to mandate it. It's just common sense. However, in relation to these COVID measures and Christmas, I mean, do you think the British Medical Journal and the Health Service Journal, two venerated medical publications, are wrong to say that these looser rules will cost lives and potentially overwhelm the health service? I mean, do you disagree with them? Are they wrong?
I think, as you say, people have been really careful all year, and as much as they love Christmas and they love their family, and the thought of getting together is really important, they are very mindful of their local hospital. They know their community doctors and their pharmacists and their nurses and those care staff who've been helping them all year. And so, as much as they might want to get together as individuals, I think people are really mindful about the pressure that it could put on those people who work so hard in their community. So this is, I mean, the Prime Minister said it himself, this is the season to be jolly careful. And people are absolutely taking that on board and doing what's right for their community.
This is music to my ears. Mims, this is music to my ears as a government minister extolling the virtues of common sense, of the public making a judgment. We're not stupid. My listeners understand the virus now. It's highly infectious. And if you're in a certain vulnerable group, perhaps you're suffering from type 2 diabetes, and maybe you're just of a very advanced age, at which point it's a serious worry. Other young people may feel less at risk, and therefore will have a little bit more of a sociable Christmas. But the BMJ are saying, look, this is going to be a higher death toll. You're going to have blood on your hands if you don't change the rules. Scotland are probably going to move on this one, as are Wales, we're expecting. Do you think the Prime Minister will ultimately be bounced into a rethink?
I think we've really tried to protect Christmas and know that after a really difficult year, getting together is something that families will want to do. But I think you've exactly described through those publications and those experts what the challenge is. And families know that as well, and they're taking stock of that themselves. So I'm sure that there's ongoing conversations, I understand this afternoon, with devolved administrations, with the government. We need people to comply. We need people to understand and be part of the solution. And I hope that whatever we come up with is sensible and right for families. And actually for our older residents, I know that they're already talking to their younger ones and their loved ones about how much they really want to be together, but how sensible that is will be down to those families as well. So I think this is something that we're all very mindful of. We've come so far. We've got the vaccine rolling out. We need to protect the most vulnerable in our communities, and families and communities, government, all coming together will make the right decision. There'll be more Christmases to come, and I hope that actually we can really have a much more positive spring.
Mims, I'm very grateful for your straight answers to straight questions, and my audience are grateful too. Two quick ones. I know you have to run. Just in short, can you essentially rule out that the Prime Minister will change the COVID restrictions for the 5 days over Christmas?
I think the Prime Minister, the Cabinet, all of government takes advice around this. Some of the stuff I've just described around compliance, around sensible conversations.
So do you think the advice, do you think, Mims, the advice might change, but the mandate will be the same, which is we're free to choose?
I think, as I say, we've always tried to protect Christmas. We know that people
Sure.
feel very strongly about being together, and we will have to weigh up what's right. And I know those conversations are continuing to start because, frankly, there's been so much change over the last few weeks with the virus as people, try to get ready for Christmas and try to shop, etc. So I hope people out and about will be continuing to be sensible. I hope that we get the best outcome for the widest amount of people over Christmas. But I know that families are already thinking about what's right for them, and that's really important in this.
I think it's a very clear messaging, and I'm hopeful that the rules don't change and that we're trusted to make that judgment. Last one. Let's end on a really high note, Mims. A deal on Brexit, a trade deal with the European Union, would be fantastic for jobs, wouldn't it? Is it coming, do you think?
I'm really pleased that we are continuing to discuss. We've had a 45-year partnership that, yes, is going to change going forward. And we'll see if it's Canada or Australia as we come to January 1. But I think businesses really need certainty. We really need to know how we can shape our recovery as we start to tackle COVID, but actually get the vaccine rolling out. So I think we should be doing everything in our power to get that good partnership, but to absolutely deliver on the Brexit outcome, the referendum outcome. We've had the transition, and business needs that certainty, and that will help us create and support those jobs. I know Liz Truss have been doing more trade deals this afternoon as well. So I think there's great news for global Britain as we go forward. There will be some choppy waters, whatever the outcome, because this is a change. But I know that what we've managed to get through this year has been difficult, and I'm sure that will hold us in good stead for what happens next with our partnership with the EU.
Wonderful, wonderful stuff. Mims, thanks very much for your time. Mims Davies is Employment Minister with the government. What do you think? Mims Davies there, reluctant to suggest the Prime Minister will change course when it comes to the COVID restrictions over Christmas. It looks to be the case that Christmas in England, at least, is safe, based upon the principles there from the Employment Minister that families and individuals will make a judgment about the risks